joining us so early in your morning. And welcome. Welcome. I see we have a few people we're still expecting to join us. This is one of our programs. This is an education of people, empower them with information that they need to make better life choices. The month of May is Mental Health Month. And so for us, it's critical to engage young people and give them an opportunity to discuss pertinent issues that will help them with improving their mental health.
Thank you so much for the wonderful introduction. So I'll just get right to it. I would like to welcome Ms. Claribel Goye. Thank you so much for joining us once again. So Ms. Claribel is a UK mental health social worker, certified, of course. So thank you so much, Auntie, for joining us today. Kindness, we're really grateful. God bless you.
Thank you. Thank you for having me again.
You're welcome. And then the second speaker is Dr. Abiri. She's a consultant psychiatrist and a lecturer too. Thank you for joining us. I don't think I can see her.
Hi, good morning,
Okay.
and thank you for having me as well. Thank you.
Okay. So I'll just get right to it. I have some questions that I sourced. So I will just ask the questions and then get the answers from you. So if anyone in the audience have some questions too, they can also like ask maybe in the chat room. So we just get the answers from there too. We get the questions from there too, rather. So my first question is, what is mental health? And why do we have to pay so much attention to the topic?
Mental health is a state of mental wellness, putting it succinctly. It's certainly not mental illness, and it is not a state of not having any ailments at all. So it's basically like physical health. If you say you've got good physical health, that's your physical wellness. So for mental health as well, if you've got good mental health, it's a state of wellness.
Well, thank you very much. And you've made very pertinent points, Claribel, on that introduction. And so some of the pertinent points that you've made that I would, of course, like to reiterate include the fact that, one, all of us have mental health. What we all don't have at every point in time is mental illness. And the fact that we also need to start getting more understanding that mental health is not a point in perspective, it's a continuum. And so while all of us can, a continuum where all of us can swing between mental illness and mental health. If it's a line, at every point in time, we are somewhere on that line. And so I would like to, describe mental health. Health, of course, is not just the absence of disease or infirmity, but a completeness of physical, mental, and social well-being. But much more specifically, we like to describe mental health as a state in which an individual is able to successfully perform the functions of the mind. Because whenever you speak about mental, you're speaking to the mind. And so people might ask, what are the functions of the mind? The functions of thought, emotion, cognition, feelings, and behavior. The reason why we encourage that people pay attention, and that's the second part of the question to mental health, is that for any individual to say that they are mentally healthy, they must be able to do 4 things, not 1 of 4, not 2 of 4, not 3 of 4, but 4 things. And that includes 1, being able to cope with the normal stresses of life. 2, contributing their own quota to the environment that they live in. 3, engaging in productive activities in the environment. And last but not the least is that any individual who says that they're mentally healthy must be able to have thriving relationships, not just with themselves, but with others as well.
Thank you, Dr. Abiri. Thank you very much for that. It's putting those four key areas out is new for me. I never thought about it in that context before. but I guess that makes it easier for one to determine how well they are doing on the spectrum at any given time. So thank you very much for that. How do you then determine how healthy you are mentally using those 4 indicators that you have mentioned? At what point in time do you say, oh, well, my health could be questioned because I feel that I'm not doing well in this one area? Or does it mean that you have to be maybe less than average at 2 out of 4? How do you determine whether someone is doing well mentally or otherwise?
So beyond those 4 parameters that mental health often looks at, it's the fact that I would also like us to look at the concept of wellness or well-being. And of course, well-being goes beyond mental health. Well-being speaks about a positive regard for self, being able to help. It also looks at other pillars of our lives. And so the pillars of our lives that I also want us to look at will include what we know as the 8 pillars of wellness or 8 pillars of well-being. And so for me to say that an individual is well, again, remember that health is about complete physical, mental, and social well-being. If we had to break down the physical, we'll have much more. If we had to break down the mental, we'll have much more. If we had to break down the social as well, we'll have much more. However, the pillars of wellness helps us to look at what we call the pillars of wellness, like I have said. And the 8 pillars of wellness, again, are pillars that every individual has to be well on. I'll mention the pillars, and the pillars are, depending on what school of thought we're looking at, the pillars of wellness and well-being would include physical, social, emotional, occupational, financial, spiritual, intellectual, and environmental. And the reason why I'm explaining this is that I would like to focus on the fact that many times in life, we are at a point that we call our real point, or the point of the real self. This is the best way I believe I would be able to explain it. And so for every one of us who is on this call right now, where you are in your journey, with whatever it is that you're doing right now, is your reality. However, the reason why we wake up every day, the reason why we do all the hustle and bustle while we're trying to struggle, is that we have an ideal that we're trying to get to. And so there's the concept of the real self, who you are right now, and the concept of the ideal self, who you hope that you would eventually be. And so when I'm asked that question as to whether or not an individual is fulfilling all that they're supposed to be fulfilling, I say, look at yourself in these 8 pillars that I just mentioned. Look at where it is that you are. So for instance, if you take physical health and you say, oh, well, I want to be a size 8, but I'm a size 14. That's your reality. Your reality is a size 8. Your ideal is a size, or your reality is a size 14. Your ideal is a size 8. However, what is the work that you are doing in the middle? The reason why I highlighted the real self and the ideal self is that, you see, the gap between where I am and where I want to get to, the wider that gap, depending on the parameter that you're looking at, the greater the amount of distress. And the wider that gap as well, the lower the self-esteem. And so depending on whether I'm looking at physical, occupational, financial, spiritual, intellectual, environmental, emotional, where am I? Where do I want to get to? How much distress do I have between both points? But much more importantly, how much work am I doing, or am I putting in to get in from what is known as point A, the real self, to what is known as point B? The question about whether or not an individual is mentally healthy is usually answered by, 1, how much distress are they facing? 2, what is the intensity and the frequency of the signs and symptoms? And again, those signs and symptoms will speak to the functions of the mind. Signs and symptoms with abnormalities in thoughts, abnormalities in emotion, abnormalities in cognition, abnormalities in behavior. So if I had to put it simply and try to make you understand how we look out for whether or not, there are glitches, I would say that this would be the perfect example. Thank you.
Thank you very much. May I kindly add to that as well? So from a social worker's perspective, Dr. Abiri is exactly right. However, there's another thought, and that is that how has the individual been functioning? What is their baseline? Dr. Abiri mentioned that, that there's a spectrum, which is right. We're all on the spectrum. However, we have to look at what an individual's baseline is. What was their level of functioning before the illness, before a note in perhaps abnormal behavior, abnormal thinking. We look at that baseline because not everyone is on the right baseline. We don't all start on the right baseline. We also, as Dr. Abiri said, we look at other factors. So you could look at things like social media. We could look at things like family as well, the pressure that they put on individuals. So is it that individual's reality, or is it the reality of what they are seeing and the feeling that they have to also be like particular people on social media? They have to do what, for instance, a child and a parent, what the parents' view is of where the child should be, rather than looking at the child's level of functioning, the child's ability. And that's just what I wanted to add to that. I hope that's helpful.
Thank you very much. Thank you very much, Auntie. Can mental health problems be prevented? And if yes, how? Dr. Abiri, can you take that one, please?
Responding to whether or not mental health problems can be prevented, the first thing I would say is knowledge is power. If you don't know, you can't do anything about the situation. And so the quote by Maya Angelou comes out apt at this time. If we know better, we can do better. If you look at the environment that we're in, the environment, the cultural issues, the religious inclinations, the stigma, the discrimination, the myths, the misconceptions, a lot of these things are shrouded in ignorance. Ignorance because we don't know. And many times we don't know because we haven't tried to find out. Sometimes it's also because we are not interested in finding out. There are many things that people don't even know are traumatic. And it's only until perhaps they come, to a therapist before they start seeing how, traumatic certain incidences that happened in their lives were. And so for me, the first thing is knowledge, information. Are people aware that mental illness is even an issue? Are people aware that mental illnesses exist? Are people aware that mental health issues can affect anyone, regardless of age, gender, socioeconomic status, or religion? Information for me is key. If we all have the right information, then we can start to teach everyone or carry everyone along as to how best it is that you can ensure that people are in health. There's been a lot of focus on physical health at the expense of mental health. And it's the reason why it looks like mental health for the longest time got the back burner position. When the COVID-19 pandemic hit and people pretty much had to put their lives on a hold, there was the social distancing issue, there was the fact that there was a lockdown and people had to stay in one place for so long. Not only did we have patients who were previously mentally ill breaking down, but we also had new cases coming up. And so what it did was that it brought mental health to a spotlight that people had never seen it in before. The honest truth is that there's no sure way to prevent mental illness. However, information, knowledge, education, advocacy, awareness are extremely important tools. Investment, of course, by individuals, by groups, which is why I must commend the efforts of the DBF this morning. And not just groups, but by government as well. And so beyond preventing mental health problems or concerns or struggles in the general population, is also that we must talk about the people who already have mental health issues. And so managing stress, learning how to, manage stress, exposure to trauma. There was a traumatic news a few days ago on social media about the death of a young lady somewhere in the northern part of Nigeria. That's traumatic. And it's not until you are in that place that you are impacted by that trauma. Even we that live far away are impacted by that trauma. And so sometimes learning what your stressors are, what your triggers are, what the threat to you is, learning how to manage stress, learning how to manage or increase your resilience, learning to heal from your trauma, because that's a conversation we don't have a lot around here. And also learning how best to manage issues of, low self-esteem, managing life events when they happen, life events like the death of a loved one, the loss of a job, the loss of an opportunity. Pretty much being able to understand that mental health issues are real life issues. And it's not until we see someone looking disheveled or not wearing clothes on the street, making mental health information available and accessible to all. In my opinion, I would believe that these are some of the measures by which we can prevent mental health problems. Thank you.
Thank you very much. Thank you so much. Ms. Kleiber, would you want to add anything to that?
Absolutely. I completely, I couldn't have put it any better. And having an understanding of mental health, as Dr. Abiru said, is really key. And to be honest, that is the start of kindness, which is part of what our discussion today is about. To understand why people, including ourselves, are the way we are. Understand our traumas, understand our life experiences, understanding how they have impacted us. Understanding the triggers, because as Dr. Abiru said, people could be functioning at a normal level and then something just happens that tips one over the edge. It's understanding that, being supportive of individuals, but key is us also finding out. One of the things that could help with our understanding is also what are genetic vulnerabilities, what within the family. I'm not sure whether that's one of the questions, but again, having an understanding of what's within our own families, in addition to other factors, are the vulnerabilities that make us predisposed to mental health difficulties. Thank you.
Thank you very much. Thank you. Okay, so the next question I have here is, how do I know if I'm unwell? Like if someone is a normal person is developing a mental health issue, at what point do you say, okay, something's wrong with me, I need to go get myself checked? So how do I know?
Yeah, so Chinelo, when you were asking the question and you said a normal person, I smiled because normality is relative.
I have to agree. So did I. What is normal?
Okay. So I take that back. I take it back.
No, it's fine. Again, it's part of why we're here, so that we all understand, how best it is and what it is to use as well. And so how do I know that I have a mental health challenge if I do? I must be honest with you, mental health conditions are one of the most challenging. And that's because the organ that is affected when there's a mental health issue is the brain. I often tell my patients that I understand sometimes why it is you didn't come in early. Because if you have malaria, you have a fever, you have chills, you have a bitter taste in your mouth, you may have, body aches and pains. That's how you know. And then you can run a test and they say, oh, you have scanty malaria, or you have 1+ or 2+. With a mental health challenge, it's much more difficult. When the brain is sick, how does it tell itself that it is sick? And so that's why we as individuals must have a high knowledge of ourselves. One of the greatest philosophers of all times, who I would quote this morning, Socrates, says, man, know thyself. And that knowing of yourself is not just, a physical knowing or a mental knowing or knowing how much money I need in my account. It's knowing how I feel per time. Am I self-aware? Am I being able to self-regulate? Do I interact well with others? Again, we're going back to the 4 parameters that we spoke about earlier. Am I productive? Am I able to contribute my quota to my environment? Can I cope with the normal stresses of life? Do I have thriving relationships with other people? By the time you go back to that, baseline, the other things you then start to look at, you now start to look at what the functions of the mind are. And so finding out if I have a mental health problem is my job, as well as it is the job of other people around me. And which is why, it is extremely important to also talk about the place of social support when we're talking about mental health issues. Beyond having people who give you money every time you ask for it, are you able to call somebody this morning if you got into trouble and say, oh, I'm in trouble, can you come and help me? Are there people to rally around you? So it's your job as well as it's other people's job to look out for you when you break down or you have a mental health issue. And again, it is not until the big things start to happen. It's not until we find out that somebody hasn't been sleeping for 10 days. Know yourself. Who am I on a good day? What are my sleeping patterns like? What are my eating patterns like? How do I react to stress? How are my relationships with other people? How do I think? How do I dress? And so usually there's a checklist that we look at when we're looking at whether or not an individual is well or not. And that checklist includes things like, behavior, appearance, mood, your physical appearance, your facial expression, which we call affect, your perception.
Hello.
Are you hearing voices of people you can't see or
Call you
hear?
later, Nabi.
Are you hearing voices of people you can't see? Are you having any unusual experiences? What are your thought patterns like? Are you thinking like you would have always thought, which is why, when it was said earlier by Claribel that you should also know yourself, baseline, who am I? We also look at things like orientation. Am I well oriented in time, place, and person? Do I know where I am? Do I know who I am? What is my memory like? Do I remember things or am I forgetting things excessively? What is my intellect like? What is my judgment like? And even if I have a mental health problem, am I aware? A simple way of testing a mental health challenge is, for instance, a patient walks into my office and I say, how are you today? She says, oh, I'm fine. Who is this seated beside you? And the patient responds, oh, this person used to be my mother, but I killed my mother and my mother is no longer here. That's a problem because it shows us what we will call a psychopathology. And so we need to start understanding, first of all, who we are. And when we start to see abnormalities in things that we do on a normal day. For instance, if I wake up today, I'm able to tell whether I'm in a good mood or I'm not in a very good mood. Either because something happened last night that upset me, or I am inundated by what I have to do today. Is it my energy levels? Am I feeling low in my spirit? Have I lost interest in things that would normally excite me or make me happy? Is it that I'm avoiding people and preferring my own company or to be by myself instead of, again, being with people? Again, who was this person prior to the issues that they're facing? Many times as well, as I try to wrap up the question, is that we also need to look at, am I as an individual faced with a lot of stress and troubles at this time? People often say that being a Nigerian itself is a risk factor for a mental health disorder. And of course, we couldn't agree more. But there are certain things that you'd be faced with. Change, challenges at the workplace, financial difficulties, loss of a loved one, no one to turn to. When we are exposed to stress that happens to us rather suddenly, that can be quite overwhelming. At that point, we can be at risk of mental health struggles, and we should actually have what is called a high index of suspicion. Thank you.
Thank you very much. Thank you very much, Auntie. Thank you so much, Dr. Abiri, for that. God bless you. Ms. Claribel? Okay, so my next question is to you now. When, from what she said so if I'm having a mental health challenge right now, the people in my environment should be able to say, okay, something is wrong with her, right? So
Yes.
what do we do, or what do I do when I'm concerned about a friend or relative's change in character or something? How do we help?
Some of the things you can do is talk to the individual, try and understand what their experiences are, what are they experiencing, what are the symptoms. Even though as a family member, as a friend, as a parent, whoever, you notice a change in the person's way of thinking, pattern of behavior. At times it's about perhaps approaching them. Now, not forgetting that at times it's difficult for the person closest to whoever is experiencing a breakdown to have that discussion with them for various reasons. I'm going to be looking at the parent and child, for instance, because it can be difficult. A parent can feel that perhaps the child is just for instance, putting it on without having an understanding that actually they're experiencing early signs of a mental health breakdown. At times, you could look at maybe someone who the child or the adult has a very good relationship with, other than the one between the parents and child. You can approach it that way as well. Because the honest truth, as Dr. Dabiri said, is that for some, we have no insight when we're experiencing that breakdown. So the reliance is on those around us. So it's about initially starting that conversation with them. If it's a difficult one, you could think about who else can have that conversation with them. It could be perhaps if you suggest to the person, I'm worried about you. I think you should see a doctor. Again, in my experience, some would say to you, no, there's nothing wrong with me.
Yeah.
There's nothing wrong with me. And that's why I thought perhaps maybe looking at someone who has a good relationship, that perhaps the individual, would respond to, would respond to in a positive light. Sometimes we as individuals, be you family, friend, or whoever, also don't have the patience to have those discussions. That's certainly common in our culture. You may start having that discussion with the child, and rather than patience, depending on the child's response, you would just say, oh, that, they're just playing up. There's nothing wrong with them. So we're in denial ourselves. And I think that is key. If we start noticing a change in someone's normal functioning, we need to start taking steps actively or seeking where we can get the help for that individual from.
Okay. Thank you very much, Ma. So I'm wondering, how can a young person get support? That's my next question to you. How can a young person get support? Like, especially one that is in denial. So how do we help?
I think it's about encouraging that person, saying why, being open and honest about what you've observed that you're concerned about in the young person. At times it's difficult for them to hear it from an adult, but maybe from perhaps a peer, a supportive peer who they're close to. They may well, accept whatever offer of support from them. In terms of support, your first point of contact is obviously your doctor, is a doctor. I can tell you that for here in the UK, that's the first point of contact. In Nigeria, there will be a lot of factors that may well impact that. But one common factor is the stigma of mental health, even for the parents as well. Whilst you might recognize that perhaps a child or not necessarily a parent, but for anyone, whilst you may recognize that a family member or friend is showing early signs, I think it's the stigma to even talk about it or one's own views. Some people would run a mile rather than take steps to help the person. But here in the UK, your first point of call is to try and get that person to see a doctor. Have that discussion, but try and get them to a doctor. Okay. If you can't get them to a doctor, you do have the option of speaking to their doctor, if known, without expectation of information from the doctor. You can actually contact a GP here, for instance, and say, I am concerned about so and so. You can put it in an email. You can certainly highlight that. Unfortunately, I'm not too knowledgeable about what happens in Nigeria, but I know finances would play a huge part for some.
Dr. Abir, please.
Yeah, so I'm happy to help. And I smiled when you said that. I smiled and then I laughed. And when Chinelo was asking the question of Claribel, I honestly also, the response many times is it depends on the context and where it is that you are. If we had to compare our own health systems with the systems in the UK, the expertise is here. Of course, the people who provide the care are few. However, what we also find is that the attitude to getting help, especially for mental health conditions, is abysmal, to say the least. And of course, that's driven by a culture of discrimination, stigma, and again, fueled by ignorance. And so many times, denial, like Claribel said, when you tell people, I think that I'm noticing something. The first thing they tell you, oh no, I reject it. It's not my portion. That's, default response to, it can't happen to me. But the truth is, the WHO has said that 1 in 4 persons at some point in their lives will have a mental health challenge. It's research-based. It can happen to anyone. It can happen to anyone, even a doctor who takes care of people who are ill. And so people coming to the point of acceptance that because it has happened to you does not mean you're a bad person, does not signify weakness, does not mean that your family did something somewhere. But very importantly, jumping on it and getting help. I think that one of the biggest problems that we have in Nigeria in addressing mental health issues is the fact that we stay at the point of denial for a very long time. And you see that denial starts from becoming 1 day to 1 month to 10 days to longer than that. A few years ago in 2019, I had the opportunity to travel for the World Psychiatric Association conference. And I went to Mexico. And there was a hospital in Mexico, about 8 floors, all for psychiatry. There was 1 floor that was specifically for what is called first episode psychosis. Now, first episode psychosis is an illness, it's first time, never happened before. And so Claribel is right that the pathway to care also differs in Nigeria. When someone is ill, comes up with unusual behavior, relatives are more likely to want to tie them up at home, call the pastor, call the imam, because we don't want to be, we don't want people to know what's going on. We don't want to be ashamed. But many times, you see that first response to that first episode will decide how better or how worse off further episodes will be. Now, getting adolescents to care can be quite tasking because adolescents don't even show the signs that adults show. They show different signs. For instance, in their own depression, you may not find out that they're looking sad or crying excessively. They might start flunking schoolwork or start doing negative things just in a bit to get attention. And so, of course, our, again, awareness and knowledge base about what is going on is very important. Not invalidating or dismissing their feelings, which is something that has happened over time. I'll give you an example. I sat in a session with a parent and a child once. Before the child came in, I told the mother, I said, do you ask your child's opinion when you want to do something? Now, this child is a 21-year-old. And the mother said, I should ask him, what opinion does he have? And I'm like, no. Asking a child's opinion does not mean that we're going to do what the child says. It makes the child feel like I am valued. What I am saying matters. This person wants to listen to me. And so whether that child is 3, whether that child is 6, whether that child is 20, we should try and make them a part of the conversation. We shouldn't always make them feel like I'm making this decision, it is the best decision, and my word is final. Improving our relationships with our adolescents and young children is, for me, the first way to even start the conversation about mental health issues. Is the first way to even start saying, oh, I have noticed that something is wrong and this is what I think I want us to do. If that relationship is there, the child will not even open up to you. The child would rather instead open up to either friends, look up things on the internet, or find someone else who appears rather comforting to them than coming to a parent. Thank you.
Thank you very much. Thank you so much. We have a question in the chat room. So it says, what about people who believe that church or religion can solve mental health problems? That's one. What advice would you give to a pastor or a parent who relies on spiritual solutions?
Yes, sorry, I'm laughing. Yes. Oh gosh. I would ask them to seek medical help, to be honest with you. Whether the pastor or church member decides to is a completely different thing, but I would be open and honest. In certain circumstances, I have had this discussion, I must say. And some of what I have said is that, well, it is the same Lord who gave the doctor the wisdom that would also help them in terms of guiding your relative. So it's important to seek advice. As Dr. Abiri said earlier, as early as possible. We have here what we call early intervention teams, and it's about everyone, including pastor, church members, the welfare department in the church, knowing all the services that are out there. And I think it's about encouraging them, because some of the issues with church members and their views is that they believe, yes, the Lord will do it. Medication wouldn't play a part. Therapy wouldn't play a part. Whereas it's not just one thing. It's about them taking responsibility. They had a church. People look up to them. It's about the pastors as well, taking responsibility to finding out what it is, rather than just one belief. That's my view. I don't want to be too negative in terms of pastors and how they can impact some, but again, it's the lack of understanding. Yeah, definitely. I think they need to take steps as part of their learning. They need to take steps to know what mental health is, what the causes are, what support can be provided, and support people, support relatives to encourage their support individuals to support their relatives to seek help. Because to be honest, a lot of people seek advice and solace from pastors, so they need to know these things so that they can provide the correct information. Yes, you can pray, but also it gets to a stage, prayers without action. You need to take other action as well.
Sure.
In the same way, if it's a physical health, I'm sure pastors with diabetes are taking their medication. I'm sure pastors with different physical ailments are taking their medication. They're not just wholly relying on, prayers. So that should be the same for mental health. As Dr. Abiri said, mental health has really taken a back seat. You have to really be passionate about it to be able to talk about it, because at times you get the stance where people just look at you and think, oh, what are you trying to say? My relative is mad. Even the words that are used, are very derogatory. And I think, yes, these topics need to start being had in churches, in places of worship, school groups, various places. I think we all have a responsibility, really, but more so pastors, because they heard quite a flock.
Thank you so much. Thank you so much. Dr. Abiri, would you want to throw more light to it?
Oh, yes, definitely. I'd like to, shed a bit more light on that as well. A quote by Patel, Professor Patel, that I like, and he says that mental health is too important to be left to the professionals alone, and mental health is everybody's business. And so I particularly like this question because what it does for someone like me is it reiterates the fact that mental health should be a collaborative effort between everyone. Nobody's intervention is more superior than the other. And so because we are spiritual people, who are driven a lot by our spirit being and the fact that, we're very prominent with God in our lives, the role of the church should be one that supports and not negates what the doctors or the physicians are trying to say. As a doctor, I'm a Christian. And so what I would say to any patient is, while you want to trust God for healing, please, like Claribel said, God has given doctors, nurses, occupational therapists, psychologists, this knowledge to be able to help you. It should count for something. It shouldn't surpass it. I mean, for instance, imagine when the COVID-19 came and some people blatantly refused to take the vaccine. Some still haven't taken it and are still alive. Oh, well. But we've seen that science can try to say that it wants to take the place of God. Again, it depends on what lens that we're viewing it from. For me, it's a collaborative lens. And I think that as much as possible, mental health experts, and it's something that we already do here in Nigeria. For instance, if you have a relative or a patient who is difficult, does not listen to the doctor, does not listen to this, you ask them, who will this person listen to? They'll say, once the pastor says this like this person is going to do what the pastor says. And so you involve, the religious institution in the care of the individual. The other thing, of course, that I would like to highlight, because it was one thing that struck my mind when you were asking questions about the role of the religious organizations, is that we must also be careful about giving entire custody, especially when an individual is mentally sick, to the church. a lot of our clients, a lot of our patients have been further traumatized, yes, when left in religious places. They've been tied down, they've been beaten, they've had salt put into their wounds. And I must be honest with you, a lot of them have actually been abused, both physically and even sexually, when taken to places of, religious gatherings, all in the name of, we want a deliverance done for this person. And so it must be a collaborative, patient-centered effort that looks at the fact that all that we want from this individual is, for one, their health to be better, their quality of life to be better, and as much as possible to ensure that they are well, at least most times of their life. Thank you.
Thank you very much. My next question is, what can one do if the support they are receiving for their mental health issue is not helping them? Or maybe from a relative point of view, if you see someone in your family, if someone in your family is receiving mental health, maybe is visiting the therapist or something, and you're seeing that this, whatever measures the therapist is giving this person, he or she is not using it and it's not working, is probably getting worse. So what can we do in that kind of situation?
The way you painted the scenario now further change things. What can we do if we think that the therapy is not working? The therapy may appear not to be working for a number of reasons. One, and I think for me that's the most important, does the client or the patient have what is known as a therapeutic alliance with the doctor or with the therapist? Do they get along? Does this individual like or is comfortable in the environment of the therapist? Is there a lot of resistance? And so there's certain concepts that we talk about, psychological concepts. They're unconscious, but we're able to pick it up. There's sometimes that when somebody comes to a therapy session, for instance, take a female who was sexually abused by a male, and you don't take peculiarities into perspective and you say, oh, I found you a male therapist, go and see this male therapist. But every time this client sits in front of the male therapist, they're triggered either by the smell of the therapist, the tone of the therapist, the look of the therapist. And so there's something we call transference. And so all the trauma that individual went through, that's all that they're thinking about in the therapy session. The first thing is that we need to know, is this individual comfortable with the therapist? Is this individual even in on the process of this therapy session? Before talk therapy starts, there's some patients that before you even start having talk therapy, you need to put them on medication for a long time. And I'm happy that Claribel is here as well. Manage as a team. We manage as a multidisciplinary team. Again, one person's job is not more important than the other. And so while you have a psychiatrist, you have a mental health nurse, you have a social worker, you have an occupational therapist, you have a clinical psychologist, at initial assessment, the family and the patient will be carried along that, well, this is the diagnosis, this is the management plan, this is what we are going to do, and this is what we hope to achieve per time. Again, nothing is cast in stone. We can only hope that all the efforts that we put in will yield great results. And so at every point in time, a person may not even need to see a psychiatrist more than once. And that's possibly because the issues are more psychological and social, based. And so when everybody works together as a team, we can then say that, well, parents or relatives can also want to be carried along. I think something that is also important is to speak to the team to get a feedback. Also understand that the patient who is also seeing the doctor has a right to confidentiality, and that there's certain things that the doctor may not be able to discuss with you, except of course, they're life-threatening. And so beyond providing the means for the therapy, be genuinely interested. There's something that we almost always do. We'll say, it's smiling too much. Oh, it's not smiling, maybe there's something wrong. Oh, it's sleeping too much. We should also be seen not to have what is called high expressed emotions. High expressed emotions include things like critical comments. You started again. This your something I started again. Derogatory language.
You're seeking attention.
Yeah, exactly. You're seeking attention. Is it only you? Hostility. being hostile to the individual, not providing what they need per time. Sometimes it is over-involvement. Have you eaten? Where are you going? The doctor said you should not go out. Are you smoking again? Are you doing this again? Sometimes it's even extreme warmth. You must eat. You shouldn't go out like this. You shouldn't. And so we need to be able to create a balance. It's a difficult, delicate place to be, but trust me, it can be learned by an individual who is genuinely interested in the health of their relative. Thank you.
Thank you very much.
Absolutely. I couldn't, sorry, I was laughing when you were saying that, you haven't eaten. Have you eaten? You've started again. Because, to be honest, we've all been there. We've all said that to our relatives, be it adult or child. And that particular tone has been taken with us as well as adults. I will go back to Dr. Abiri's quote, which is one of my, the earlier quotes you mentioned, which is Maya Angelou: when we know better, we do better. We're all learning, it's a learning curve for all of us, but understanding, if we start from a place of kindness and that's understanding, we will get there. But focusing on the question, particular question, I also want to add to what Dr. Abiri said, that you're absolutely right. It's a multidisciplinary approach. As she said, a patient, a relative, may not need to see a consultant psychiatrist more than once or twice just for a review. So it would be the ongoing work that, for instance, I'm talking about in the UK, which is exactly similar to what she said. You would have an allocated worker. It could be a nurse, it could be a social worker. You could be allocated to an OT. You could also be discharged back to your GP. So you may have come to see a psychiatrist. We've taken as much history as we can. It could be a joint appointment with the psychiatrist and a social worker or any other professional. You may be discharged back to your GP, but for you to access what we call primary care services, you don't necessarily always have to be under what is known as a CMHT here, which is a community mental health team. You could be managed with primary other voluntary services in the primary sector. Dr. Abiri touched on early intervention, that it is key in the early stages of experiencing a breakdown for one to seek support. And that is what we have here, that is called, for those who are here, for the benefit of those online who are here, what is called the early intervention team. It is key. They have more resources than what is a community mental health team. And they do put a lot into clients. So first episode psychosis doesn't necessarily mean, or first episode breakdown, that a person cannot go back to normal functioning. Another thing that is important to note is that someone with mental health difficulties can contribute to society. They can work, they can be equal contributors to society. Some of us would not know that, if everyone has mental health, then they're doctors, they're lawyers, they're social workers. I've worked with colleagues who have had breakdowns. It doesn't mean that you are less of. It simply means that on that mental health spectrum, you were somewhere, something tipped you over. We're all on the spectrum anyway. And it doesn't mean that you can't get back to what is your normal functioning. So yes, I just felt to add that to this question.
Thank you very much. We have 2 questions here. So if you wouldn't mind, you take it for us. How can you avoid a repetition of stress-related issues at work after going through all the necessary support, knowing it can affect one's physical health and work productivity?
That is, again, a place where things like your managers or HR at work should also be included in this collaboration of understanding of mental health. So it could be that certain things, if you have a breakdown, for instance, you can do a graded return back to work, but also within the workplace, how can we minimize the stress? It could be perhaps, the demands on you could be addressed. It's about also being able to say, I can't manage this, or being able to speak up and say, this is a bit too much, or seek help rather than putting yourself under a lot of pressure. I use, and my favorite word, they know me at work, before I say one thing, I'm saying self-care. It's self-care for me. When you go and learn about self-care, I take on what I can manage. Dr. Abiri mentioned earlier that during the COVID crisis, even people who were well in quotes, who were functioning became unwell. A lot of people, some of it was the anxiety of, COVID, a lot of people passing around them, what's going to happen, a loss of job, losses can really tip anyone over the edge. Loss of job, how am I going to manage with my mortgage? How am I going to manage even, supporting people that I'm supporting back home? So it's about having that understanding within your place of work, you as an individual, what can I manage? And having in supervision, for instance, because we're talking about the workplaces, have that discussion with your boss. This is what I can manage. To be honest, in all, or I'd say most employers in the UK, there's something as, what we call, you have to adhere to what is the Disability Discrimination Act. You cannot, because someone has a mental health, not welcome them back into the fold of the organization, but also not take steps to put things in place to support them to be able to function. And that also means looking at what they can manage.
Okay. Thank you very much. So the second question is, you mentioned social media.
Yes.
So it says there is an increased notion that social media is contributing to the increasing cases of mental illness. Is this true?
I mean, it's different for different people. I'd say there's an element of truth. Again, it's about our ability. I look at social media. I'm not flustered by, what anyone is putting on, but then people who are quite vulnerable may well be. It's looking at why is my life like this? Why is my existence like this? Why can't I be like what I'm seeing on social media? Whereas half of what is on social media is just, as Nigerians will call packaging. That's the only way I can describe it for one to understand. It's packaging. It's not real. Some are, and it's individuals' choice to flaunt whatever they have. But I think it's about that understanding. Why flaunt what is not real? Why not tell people about the times that you've had to crumble or you've had to deal with a relative here, there, and everywhere, and educate ourselves that way? Why must it be that I have to have a $10,000 watch, or I have to be in a Lamborghini, or things like that? There was one video I watched recently, and I must mention that was shared. Is this pastor? So she's doing well, Pastor Adejumo, who spoke about bag is bag. Whether I carry Ferragamo or I carry Garafemo, bag is bag. It's about us being comfortable in ourselves, because some of what we put out there impacts those who have quite a low self-esteem. There's some who don't. They're not fazed by what they see on social media. But sadly, there are a lot of people who are. So it's about your intent. What is your intent? Do I need to know you're carrying a Ferragamo bag? No, hell no. If you want to carry a Ferragamo bag, I can, equally order online and buy the copy from China and carry it if I want to. So it's about, yes, as you rightly said, it's about, is your intent. And that's where this kindness, really, we have to go back to kindness. What is your intent? Show off. We will, all these things we would leave here, we won't take with us.
Right.
By the time you are then experiencing a breakdown, you won't even have the mindset, the wherewithal to think about those things. Don't get me wrong. I'm not saying that if you have your money and that is what you want to wear, please wear it. But flaunting it and trying to make people feel less than is not right. That is wickedness, it's not kindness. So it's your intent. So using social media, what is your intent?
Okay. So I don't know if anyone else have any questions on mental health, because we're about to go into the second phase of the conversation, which is talking about kindness and impact of kindness. So, okay. So I'll just get right to it. Sorry. Okay, so it says, the last question on mental health. Most organizations are looking at appointing chief wellness officers. What are the critical areas of concerns for this new position? And how can we ensure that it isn't just greenwashing or feel good by companies? Ms. Claribel, please. Thank you.
I think it's a good thing. Wellness officers. That's in organizations in Nigeria, right?
Yes.
Yeah, I think it's a positive thing, because if everyone is unwell, who's going to run the company? Who's going to work? So investing in staff, I think, is a good thing. If the intent is kindness, certainly. I mean, one of the quotes on kindness that I was looking at in preparation for this is by Plato, which says, kindness is more than deeds. It is in one's attitude, in an expression, a look, a touch. It is anything that lifts another person. It's also about what you're doing without expectation in return. Well, in the organization, they're going to expect you to function to a level. So I guess I'm not sure how that fares, but yes, sorry.
If you permit me to add to that, so I
sorry, beg your pardon. Oh, yes.
No, in addition to all that Claribel has said, is also the fact that I think this is an extremely welcome development, especially because, as adults, we spend a third of our lives at the workplace. And so another major source of stress, or a major place where we get faced with workplace, peculiar stress, is the workplace. And so the conversation is now moving towards what we call employee assistance, the EAP, which I'm sure that Claribel is very familiar with. It's still gaining grounds in Nigeria, but a lot more organizations are opening up to it. And so when I hear the conversation about chief wellness officers, of course, I'm extremely happy because I'm an EAP practitioner, and I know that it's a conversation that a lot more organizations are having. And they're having those conversations because you don't just bring people to the workplace. People come from families, people have issues outside work. They have financial issues, legal issues, they have family issues, they have drug abuse issues. And so hoping that when companies decide that they want to start these procedures, they go through, well thought out protocols to ensure that it is not an exercise in futility or it's dead on arrival. That's what I would say. Thank you.
Okay. Thank you very much. So thank you everyone for staying on with us till this moment. We're about to enter the second phase of the conversation, which is kindness. So I would just want someone from the audience to explain what he or she understands by kindness, and then we'll take it on from there. Thank you. Yes, please. Thank you very much.
Yes. When people say kindness, to me, it's just looking out for your other fellow human being. That's what I understand as kindness. So if, for example, someone was to walk in the street and you can see that obviously they're all upset, they're crying, just tap into your emotional being and maybe walk up to them and just say, how are you? How is your day? If you see them crying and you can genuinely see that they're upset, I feel that you can just lend a hand. That's what I understand. I do know a lot of the time in the UK, a lot of people are a little bit skeptical about doing that because you never know whether the person is going to call you names and stuff. So you're a little bit hesitant, but sometimes you can weigh up the situation yourself and then just lend a caring hand to a person. That's what I understand as kindness.
Okay, thank you very much.
Can I just add a bit more to that, please?
Yes, please. Thank you.
The words that come to mind when you say kindness, I believe is words like being thoughtful, being considerate, being helpful, giving a helping hand, thinking about all others, most likely treating and hopefully treating others how you want to be treated. So those are the words that come to mind when you say kindness.
Thank you so much for that. So my first question for our speakers now is, maybe they should explain kindness to us too in their own, your own perspective. Ms. Claribel, please.
I'll go back to the quote I read earlier by Plato. Being younger, before I read that quote again, when I was much younger, I thought kindness was just that, helping people. It's about what is happening at that particular point in time and whether the kind attitude or to be kind to yourself, if we're talking about health, you have to look after your own health as well. Otherwise, if you're not in the right place, there's no way you can help others. You know, it's all right saying to someone else, you need to take this medication or that medication, you need to go and see this therapist or see that therapist. If you were experiencing the same ailment, what do? You know, do you seek help? So it's about starting with kindness. You have to start with yourself. So it's understanding, but also with self.
Okay. Thank you so much. Dr. Abiri.
Yes, thank you very much. And, you know, I like the perspective through which, you know, Claribel came from. Many times, there are many concepts in life that when we look at them, we're looking at them as giving them to others, but not to ourselves. And kindness is one of those. In fact, sometimes people look at love, or like, oh, love, I love you, I love you. It's about others, not about self. But there's, you know, definitely that part, and I'm happy that she said it, that it's something that we give as much as something that we get, but also something that we put ourselves first on. I mean, in the bit of self-care, kindness is extremely critical. For you to even think about caring or catering to yourself, it's because you want to be kind to yourself. And so if I were to talk about kindness again, it's, you know, using this quote that says that kindness is giving hope to those who think that they are all alone in this world. Kindness is seeing the best in others, even when they can't see it themselves. Kindness is something that anyone can give without losing anything themselves. And kindness is not what you do, but who you are. And so, you know, something that I say quite a lot of times is I find it difficult to thrive in certain environments. Environments where I feel a lot of negative energy, environments where I feel like, you know, people are not in my best interest. They don't have my best interest at heart. They are just all about themselves. And so people who are kind, sometimes in being kind to themselves and showing compassion to themselves, because of course for me, kindness, compassion, and empathy and love go hand in glove. Sometimes in a bid to show kindness to yourself, you also withdraw from negative people, places, or processes that make you feel bad or make you doubt your own self rather. And so kindness is not just something that we give or that we show or that we portray in certain situations when it is convenient. Kindness, it's who you are. It's a way of life. It's a sense of being at all times. Thank you.
Thank you so much. So having self-focused kindness in mind and others-focused kindness in mind, how would you say kindness affects our mental health?
All right. So again, kindness is extremely important when it comes to mental health. I feel like kindness is one of those things that we were taught, some were taught, some were not. Again, you know, many of the things that we learn in life are largely about nature, the family we come from, our genes, and nurture. And many times it's also an interplay of these two factors. It may sound sad to say, but quite a number of families don't teach their children rather, to be kind. They don't see it as value. They don't see it as important. They don't see it as something that needs to be done. They're like, the world is going on so fast anyways, who has time for kindness? And so they put kindness, like mental health, on the back seat. But these are, you know, foundational values without which people can't appreciate the world. They can't appreciate what it is that they're supposed to give. And so kindness in itself works, of course, with other things. But in mental health, what we found is that kindness is an antidote to isolation. It creates a sense of self and well-being. If you are kind to yourself or you are kind to other people, you want to go out of your way, even when it is not convenient at all times, to show this individual that you care for them, that you are there for them, and that they can always, you know, reach out to you in difficult situations. Kindness, of course, can affect mood. It's interesting that, you know, this month as well, one of the many themes that has been drawn up for the mental health month is also the theme of loneliness. A lot of people are lonely in this age and time, in spite of the fact that we have so many ways to connect. If I did a census on this platform now and I said, how many social media platforms are you on? The average we'll probably get is 3. But if you then go ahead and ask, if you were in trouble, if you needed something, if you wanted to turn to someone, is there someone you can call? Is there someone you can reach out to? kindness helps with loneliness. It helps with isolation. It helps improve an individual's mood, self-esteem, and of course, it teaches empathy, compassion, and love. And so for me, kindness affects many people in different ways, including the fact that it can help us reduce our stress levels at all times. Thank you.
Okay. Thank you so much. Clarabelle, please. I know you're the queen of self-care, so please enlighten us on how to take care of ourselves.
Oh gosh, yeah. Yes, you know, I agree with everything Dr. Abiri said. So self-care, you know, look after yourself. Self-care means different things to different people. If part of self-care is taking time off, you need to. It's exactly what Dr. Abiri said. You know, if you're within certain circles, or you notice that when you meet up with certain people, it's all negativity. You have to be able to remove yourself, be able to say no. That's also kindness. If something is requested of you, it's about having an understanding by the person requesting support, but also you giving the support. Can you do it? But also, if you can't, being able to say no. At this particular point in time, it's how you say it. I'm sorry, I can't do that. Or I can, but this is when I can do it. It's about being open and honest, being true to yourself. Someone put that in the chat. It really is about being true to yourself. You know, self-care, part of it is, yeah, taking time out, doing what makes you happy, you know, going for walks, gardening, you know, that's all very good. We all have the land in Nigeria. I'm not sure whoever goes into their backyard and does a bit of gardening. That's good as well. It's good for the mood, good for the spirit, good for one's well-being. Yes, for some people, it is going to church. That's where they meet people. However, in terms of isolation, there are some people that actually do just like solitude, like their own space. But again, it's about balance. So self-care really is about balance of things. You know, it's staying at home 24/7 and perhaps not going out, not having contact with the outside world, and perhaps maybe, as Dr. Abiri said, you know, you've got God knows how many social medias. After a while, you know, your thoughts are going to be running away from you. Yes. Sorry, I'm just reading could also be a family member, you know, taking them in certain doses. If everything is negative all the time, you may have contact with them, then you know what? It's about being able to say, you know, maybe we need to have this on a once a month basis, or, you know, I'll see you whenever I see you. It's about being able to say that, because at times we put pressure on ourselves because we want to be seen as nice, you know.
Okay.
Sorry?
A question in the chat room. It says, sometimes if the person is a family member who you cannot remove yourself from or avoid, what do you do?
Then you take time out. You can. You can't avoid, but you can limit the time of contact. You can limit the period.
What if the person is living in your house?
Living in your house, then you put boundaries in place. That's part of self-care. You put boundaries in place.
Well, so, you know, to emphasize what Clarabelle is saying, sometimes our major stressors are actually people we live with, people we see almost every day. And sometimes there's no place to run. And so, as you know, putting boundaries in place as a form of self-care, some of the other things I also encourage that you do are that you learn certain soft skills that would also help you become better at dealing with these individuals. And when I say dealing, I'm not using that word in a negative light. Being able to cope with, manage, handle these individuals. What are some of those soft skills? The soft skill of assertiveness, saying what you mean and meaning what you say, not being emotionally blackmailed or, you know, made to feel, you know, gaslighted by this individual. Apart from that, you also need to learn communication. And many of us think that, oh, once I can speak, I can communicate. No. Sometimes you are not communicating effectively. You need to understand the other person's, you know, communicative style as well.
You know, the other person might be on a hype, and perhaps maybe at that particular point in time, one doesn't need to be.
Yes, so sorry, the network threw me out again. And so I don't know how much you heard, but what I was saying was soft skills of assertiveness, communication, emotional intelligence, resilience, and empathy. You need to learn how to protect yourself even when you are in a negative environment. You know, the example I always give when I talk about that is, I was always talking about Katrina and all of that. The eye of the storm is the calmest part of the storm. And so you can still find calm. It's difficult, it's tough. It might be very tough to achieve, but it's something that with constant practice that you can learn and also put in place. Thank you.
The question from the group, it says self-care and self-love seem all the range and on trend. It is argued that it engenders the feelings of selfishness and negates self-regulation, empathy, and compassion, especially with Gen Z. How do you walk with the tightrope of self-care and other care as a person who works with different hats, family, work, etc.?
And that's where the balance comes in for me. So I practice it at home. I practice it at work. Certainly, I practice it amongst friends. And for me, it's about boundaries and being open and honest, saying what I can and what I cannot do. Self-care is certainly not selfish, because otherwise, then what you're doing is responding to everyone's need. You're responding to all the demands on you without taking time out to care for yourself. And that is what self-care is about. It's not saying you alone, it's saying me too. So I also need to take care of myself to be able to give you what you are asking, be it my time, be it knowledge, be it practical, be it emotional support. I need to be in a place where I can give you that. Otherwise, I'm of no use to you. You can't give from an empty cup, basically, is what self-care is about. So it's about taking care of yourself as well as others, rather than instead of others.
You know, I've seen the concept of the Gen Z being asked in this question. One thing that I encourage everyone to do, professional, non-professional, clinical, non-clinical, is that we must learn about the developmental stages of children. What my child be doing? What are the influences that the environment has? And the one person I always turn to most times is that I turn to the psychologist known as Erik Erikson, who described, the interplay between the psychological or the psyche of the mind and the social environment, the impact that the social environment has. If we are able to understand the foundations, what the developmental process is, what is expected per time, we may not know it all, but at least it gives us better information on how best it is to deal with or work with or handle, regardless of any generation that we're working with at any point in time. And so Erik Erikson's psychosocial theory of development is one that I would encourage people to read about. Thank you.
Thank you.
Yes,
so
and also
much.
know that there's a very thin line between kindness and enabling as well. I just thought I should add that as well. So it's about recognizing that with Gen Z.
Okay. So my next question is, can kindness remedy some mental health crisis? Ms. Clarabelle?
Yes, it certainly can. It definitely can. It's about empathy, understanding, compassion. It can do. So if you notice that someone is experiencing a mental health crisis, for instance, it's about your approach to them. Being there, it's about uplifting people. What can I do for you? One of the participants mentioned earlier that at times you can feel that approaching someone, you can feel a bit apprehensive about doing that. If it's a member of the public, you see someone in public, perhaps maybe crying or upset or whatever, you can approach them. Obviously, you have to, we say here, you're assessing the risks as you're doing that. It depends on how the person is presenting. If you can't approach the person, then certainly you can call for, services here. So then that is a show of kindness. You can see someone in distress, and you're thinking, okay, I'm a bit apprehensive about approaching the person, but I can call for help. That's, showing kindness as well. And that will certainly help ensure that the person gets the intervention that they need. as parents, again, it's about our approach, communication, as Dr. Abiri said. At times, you know, perhaps we're tired, you've come back from work, you're stressed, you know, you've got other things going on with you. It's about maybe thinking about how you approach, how you communicate with the child, how you communicate with the adult. We all, you know, we all have our shortfalls. And I guess for some of us, that is it. It's about our approach, our communication style.
Okay. Okay, so Dr. Abiri, please, would you shed light?
Definitely. Thank you so much, Claribel. And so, you know, if I were to lend more of a voice to that, I would say that kindness is important to us as psychiatrists, because what we've seen is that people who are shown acts of kindness, and even people who show acts of kindness, so both the giver and the receiver, are more likely to have higher levels of what we call the happy hormones, endorphins, neurotransmitters. A kind act will make you feel good about yourself. And of course, the person who also receives the kindness is that increases the level of what is known as oxytocin. Oxytocin is also cuddle hormone. And so if the act of kindness is just a hug, a touch on the hand, or a warm embrace, what we see is that oxytocin is released in leaps and bounds. It makes us feel connected to each other and also helps us to trust other people. Kindness also helps us reduce the level of stress hormone cortisol. And so either in giving or getting acts of kindness, it reduces the hormone cortisol. So it's extremely important for us to show acts of kindness. There's something that kindness does for us. And it is that it helps us to learn how to cope in difficult situations. So kindness has benefits, not just to the person that we're giving it to, but all of these benefits and the fact that it teaches us vulnerability. It teaches us that people go through tough times while we may not be in a tough time just yet. Should it happen, we are more likely to be able to cope as compared with someone who never reached out to someone else in a tough time or situation.
But yes, it's important. No, on a more serious note, it is important it really is important to show kindness to ourselves and to others. You know, the topic is it certainly it helps our mental health. It certainly helps our physical health. It helps our whole well-being. To be honest.
Thank you so much. So I want to share a few things on kindness myself. Amo, please, can you go to side effects of kindness? Or does anyone else have any questions to ask our speakers on kindness before I do this? Any questions on mental health, kindness, anything?
Hi,
Okay.
I have a question. My name is Joseph. Hi.
Okay. Hi, Joseph.
Hi. How do you handle a referral and not complicate the person's life and make it look like you are betraying the person? For example, it's typical that I, for instance, have a lot of friends that are women, and a woman would come to me with a problem or something, and I find it more comfortable to refer to my wife to help me deal with that person, to help me. Maybe she's a deaconess in the church. She knows how to handle people. I prefer to, but how do I handle that in a way where it doesn't look like a betrayal, like I'm telling that person's story?
Okay. Ms. Clyber, would you want to take that?
Thank you.
I would have a discussion with the person. It depends on who it is. I would have a discussion with the person. It really is a difficult one, to be honest with you. If you feel your partner or someone else is best placed to have that discussion, then absolutely fine. That's why early on in the discussion I mentioned that even if you're concerned about someone and feel that it's difficult to approach them, there are other ways. You look at who is the person that you feel the person you're concerned about would listen to, or who would be able
I
to
think,
address? Sorry.
okay, sorry. I think I'm not sure, but I'm thinking you're misunderstanding his question, because he
Okay.
said
Referrals.
he has people come to him and tell him their problems, and then he thinks the wife would be in the best position to answer, like to give them solutions. So directing them to the wife, like it's not like they're in denial, but like what would he do in that kind of situation?
So could you repeat that?
Would he, like, first of all have to take permission from the
No, I normally would.
the
I normally would. But what I'm trying to say is, how do you make that not sound like a betrayal, where the person now feels like you've carried her story somewhere?
You tell them, you ask the person, are you able to discuss it, that you feel, you tell them your view. I feel this particular person will be best placed to hear this, to help you. You know, it's about consent. Can I share with them? Can I have that discussion with them? I mean, we have that here as well. I think it was mentioned earlier on, even if parents, you know, raise concerns, there's certain things that a doctor wouldn't discuss. We have to have the person's consent to have that discussion. So that's what should happen. It's about open discussions. And if they say no, then really there's nothing else you can do other than encourage that person to themselves have that discussion.
Okay, thank you.
Okay, I'm also thinking, okay, no, consent first, because I was gonna say, what if you get the knowledge from your wife and maybe disguise the question and then transfer the knowledge to the person, but then you have to say the actual story of the person. So consent still matters.
Okay, thanks.
Okay, you're welcome. Okay, I want to share side effects of kindness. Okay, no, can you go up a little bit? So I made this up. 5 effects of kindness. 1, kindness makes you happier. When we do something kind for someone else, we feel good. When someone does shows us acts of kindness, we feel good. So, you know, when we Nigerians, we like asking about side effects of stuff before we buy them. Oh, what does this do? Like, what's the after effect? This is the after effect of kindness that we're preaching today. So kindness makes you happier. And kindness is good for the heart. Acts of kindness are often accompanied by emotional warmth. Kindness, then number 3 says kindness slows aging. Don't quote me on that, but yeah, kindness slows aging. Because when you're happy all the time, you're showing kindness, you won't be having wrinkles, you know. So kindness improves relationships, and kindness is contagious. So please show acts of kindness. And to everyone on here, I'm encouraging us maybe this week before the month of May runs out, and not just this month because it's mental health month, but like continuously keep showing acts of kindness. So I'm just going to give example of how to show kindness in a workplace. Number 1 says model kind behavior. For example, behave compassionately. Number 2, share light-hearted moments with your work colleagues or your boss or something. That's number 2. Then number 3, get to know your colleagues, show interest, ask about their families, ask about their hobbies. Yeah. Then number 4, actively listen. You know, don't jump when they are talking. Just listen. You know, don't interrupt them. Don't say you're part of the story yet. Just listen if they come to you with stories. And then number 5, offer to help out with tasks in time of need. Then number 6, share stories of compassion. Do not accept belittling of colleagues. Accept a difficult situation. Tidy up after a meeting. Apologize for mistakes. Offer to stay late or come in early to help a colleague. Praise a colleague to the boss. So these are simple acts of kindness that we can show in our workplace. And then this is the next list I'm going to spell out for everyone is just to give us tasks on like how on showing kindness, you know, what we're going to do in this coming week. So please just keep going. Okay, so while you're doing this, we'll appreciate it if you can use our hashtag on Instagram. Maybe if you want to snap about it, or if you want to we just want you to use the hashtag while you show acts of kindness. So give up your seats in school for the young people on here, maybe in school, or maybe you get on a bus, you see an older person standing up in the bus, you can just give up your seat and help them sit, and then you can post about it. I helped someone today, and hashtag BDBF kind and kindness matters. Those are the two hashtags. I will drop it in the comment section anyway. And then hold the door open for someone, regardless of gender. It doesn't have to be ladies all the time. You can hold the door open for a man too. Yeah. Joseph, you like that one. And then give a sincere compliment. Yeah, when you're complimenting someone, mean the compliment. Don't just say it because you're looking for favors. So give sincere compliment to people. Do it in this coming weeks and just keep practicing little acts of kindness. Then you can also take time to really listen to someone. You know, like we've listened to our speakers. One of the mental health issues is revolving around loneliness. So sometimes people don't have people that will listen to them. So if you are in a good place and you are mentally able to maybe accommodate someone else's problems, I would suggest you listen to them and then give your honest opinions about them. And if it's something you can't handle, you can refer them to maybe a professional that can help them, or you just listen. Sometimes that's just all you need to do. Just listen so they air their opinion. Let one car in every journey as you're driving. And this is for every car owner on this platform. Please, as you're driving, especially in the streets of Lagos, you don't have to be racing. It's not Fast and Furious. So you just let someone in every once in a while, just to show kindness. Even if you're in a haste, self-kindness matters too, but just you understand what I mean. And then offer your change to someone who is struggling to find the right amount at the supermarket. I mean, that one is clear, very clear message. So pay for a cold drink for the person standing behind you in the school canteen queue. Donate unwanted items to charity. Just declutter your closet, open it up. Some of us have clothes that we've not used in years and it still has stacks on them, but because you have this emotional attachment to material things or whatever, you just want to hoard them. Open up that wardrobe today and share. Bring out things you're not using, load them up. You can take it to what's this one? IDP camps, where people are in need of clothing. So you can just give it to someone that needs it. Then say sorry. And then I said, you know who to. Like, most of us have enemies that will not want to admit that they are enemies. So if you know you've really offended someone, you don't have to wait for the person to come up to you and say, oh, you've offended me, I demand an apology. Just call up the person. Oh, hey, I'm sorry about what happened so and so time. I hope you can forgive me. So say sorry, apologize. It's part of showing kindness. And alms given to the street beggars, random hospitals /prisons /motherless baby visitation. So yeah, these are my examples. I mean, if anyone else have examples, they can always share. But yeah, that's thank you so much to our speakers. Ms. Claribel Goye, God bless you. Dr. Abiri, you've just unloaded all your wisdoms with us today. So God bless you all. Thank you so much. And I think I will just step out for now and call on Miss, Miss Vivian, your hand is up. Sorry, you can come up now.
Okay, I just wanted to say thank you very much to the speakers and thank you for everybody that has joined us. And we really are looking forward to people sharing their acts of kindness and what experience they had when they did that. DBF has started off by offering tickets to the Africa Magic Video Awards tonight to 4 young people who ordinarily would not have the opportunity to attend. So that's us triggering the acts of kindness. We'll share the experiences as we go along.
Flights included.
Thank you. Thank you.
Very important question, yeah.
Reach them around. I would have loved to attend myself. Thank you,
Thank
Auntie.
you. Thank you for having us.
Auntie Vivian, please send me a jet or something. I want to attend to.
There's somebody called Mousy who has a question.
Yes.
So can we please
Mousy,
ask the question?
Please, can we
Okay,
have this conference in future solely on how to handle children 0 to 19?
Seniors.
Children's mental health for children. Yes, we'll definitely we'll speak with our speakers and we will get back to the house. So thank you very much for bringing this up. We were looking to put in a program together to address this, and we will get back to you on this. So this shows me that we've been engaged throughout the session. I hope everyone can still hear me.
Yes, I can.
Yes.
Okay, I'm not really getting it. I'm not getting feedback from other people. So I'm going to ask since you can hear you, I'm going to ask you to please, I'll put you on the spot by saying, please close out if you can hear me, since most people can't hear me.
Okay. Okay, thank you very much, Ify. I hope everybody can hear me.
Yes, we can.
Yes.
Thank you very much, everyone, particularly the speakers. It's been a wonderful session. And this is like Ify said in the beginning, May is Mental Health Awareness Month. And we just felt that as it's early days for us as an organization, and we just felt that one of the ways to trigger some of the programs that we're rolling out for this year is to start with a mental health talk. I'm particularly grateful to Dr. Abiri, who I actually had never met, but was so willing to take part in this, and everybody else that has taken time out of their busy Saturday afternoon to join us for the talk. Wishing you the best and enjoy your weekend. We will give you feedback from our young people who attend the event tonight. Thank you very much and bye-bye.
Thank you. Take care, everyone. Bye.
Thank you. Bye.
Thank you. Bye. Thank you.